So as I mentioned earlier, this presentation was developed based on the most recent fact sheet, the Real Lives Law, and it's really what the law says about self-direction, the current status, and what needs to happen. The fact sheet can be found in the MA21 document library. I do want to thank Chris Hubbard for just helping us out, uploading documents that we wanted folks to have easy access to as of today. And then for your convenience, we placed a number of important links that will be mentioned in today's presentation on the last page of this slide deck. So if possible, we'll also try to put them in the chat as we go along. So the right to self-direction, the Real Lives Law states that every adult eligible for services through the Massachusetts Department of Developmental Services has the right to self-determined supports. This includes choice over services, goods, and the providers to provide that level of support the person needs. Self-direction is a legal right, again, under the Real Lives Law. The current status, there continues to be ongoing challenges that are reported by persons self-directing, those who are interested in self-directing, families and providers. There's limited information and guidance as it relates to the self-direction service model, and again, barriers to fully using the self-directed service model. So what needs to happen? Most importantly, what does the Real Lives Law require? And that's for DDS to facilitate and assist with a person-centered plan, the development of an individual support plan, the ISP, and annual individualized budgets based on assessed needs. Access to independent facilitators is also required. We did reference the Real Lives Law. This is where you will read and learn a lot about the self-direction, not so much the model, but what the Real Lives Law says. So our presentations, we always reference the law and the regulation. So again, the link is provided for easy access. So this is here. I'm going to open this up to Robert Beckett as he presents on this particular topic on the budget and budget equivalency.
Okay, thank you. My name is Robert Beckett, and I have a son with Down syndrome who's 47, and Thomas lives with me and my wife, the mother, and he's been in self-direction for about 7 or 8 years. I just want to say premise, I would encourage everybody to read the fact sheet that was revised in December because of 2025, because it updates our previous fact sheet, and it comes after the regulations were finally adopted in November of 2024, so a little over a year ago. And it also comes during a period of time when both DDS and kind of an enlivened self-determination advisory board are, I think, really working on further developments in the self-determination under the Real Lives Law. So please read the fact sheet. So we're going to spend a little bit of time, just 5 or 10 minutes, on the funding allocations in individual budgets for under the self-direction law and under the regulations. So what the Real Lives Law and the regulations say, and they're cited at the bottom, is that DDS must set an individual budget annually for self-direction. It has to be equivalent to what DDS would have spent under a traditional model of services. It must be based on assessed needs, must be developed within the person-centered planning team, and DDS may review utilization, that is what's the past utilization of services, and then adjust the budget according. Uh, You want to go to, could you go back to that? Well, that's okay. You can stay. Yes, you can go to the next one. That's fine. Um, the under the DDS regulations that were promulgated in November of 2024, and as required by the Real Lives Law enacted in 2014, you can appeal if your budget is not based on assessed needs, in your opinion. Those assessed needs are determined by the department, but you can question the assessed needs. And if the budget is not equivalent to what DDS would have spent under a traditional model. So you have the right to appeal those budget decisions. And what I would say is that MA21 spent a lot of time on the individual budget and based on equivalent cost and also on assessed needs. So if you go into the library, MA21 library, you'll find that there was a November 2024 webinar on individual budgets and how they might be approached in terms of equivalent cost. There was a March 2025 webinar on the needs assessment process and how that can be utilized in formulating the individual budget. And then in September of 2025, we had a thorough webinar on appeals, including appeals under the self-direction, which are separate from, although they're joined in some ways with separate from the appeal process, generally available through the individual planning process. Okay. So one of the things that's occurred in just the last year is that the Massachusetts Developmental Disability Council, which has been a long-time coalition member of MA21, in concert to some extent with MA21, at least in collaboration, developed a survey. And in fact, the webinar of that was held in MA21 in November of 2025. So that was another one of our webinars that is available, and you can see it November 18th is the PowerPoint presentation on it. So these were the preliminary results. And let's go to the next slide. So these are excerpts just dealing with budget. Have your service and support needs changed during your time using self-direction? 49% said no, needs have stayed the same. 51% said, no, I've had more needs. Is your budget enough money for the services you need? 44% no, 29% maybe, not sure, and 27% yes. Want to go to the next slide? So you all can read this, but we're glad and grateful to be part of participant-directed program. We're very concerned that DDS received a rate increase for day programs, but that is not applied through the PDP activities. So in this case, the family is having a difficult time adjusting to the fact that they didn't get a rate, they didn't get a equivalent type of rate increase, or it wasn't passed on to self-determination. Next slide. As far as needs are changing, 49% said the needs stayed the same and 51% said that they had increased, but 63% of people said that the budget stayed the same, and only 14% said it increased. You want to go to the next one? And this was another statement, an excerpt. We've been involved in self-direction for 8 years. Our budget has not increased in 8 years, despite showing need and having to offer increased hourly rates to hire staff. This is not sustainable. Traditional programs have had increases. Why not self-direction? So one of the important things in terms of moving this along, MDDC has been getting additional participants in the survey, and hope to have a kind of a more final version and digging a little deeper than they did in the November presentation. So the next MDDC presentation on the survey is going to be their own presentation, and its registration is required in January 29th. So certainly we'd like you to join that if you can. Okay.
And I just want to mention that if you go to the MDDC website, you'll be able to access information regarding the survey, but also regarding their meeting that's coming up on January 29th.
So obviously from the MDDC and from our own anecdotal experiences, the individual budget being based on assessed needs, being done every year, recalibrated every year, and also being based on traditional services, what the DDS would have spent on traditional services. It's obviously combining all of that a significant topic for people in self-determination. So from the standpoint of a long-term plan of DDS, DDS has contracted with Human Services Research Institute and to develop a needs-based funding model. It's been the support intensity scale. And the idea here was to utilize a different needs assessment, different from the MASCAP and ICAP. And in order to do this correctly and have a correct survey, they needed 1,000 sample assessments, 500 self-directed and 500 traditional. They have about 670 assessments completed to date. So ultimately, the idea of this assessment was to tie these support intensity scale assessments to the what would be the traditional costs of services or services in the traditional model. So one thing that people could do is if they want to, they could go to the Path Forward Project Implementation link at the bottom. That's a DDS link. And they could, there's a link in that to allow you to determine whether or not you would be able to participate in the remaining assessments. It'd be very helpful if we can move those 670 to the 1,000 so that we can get on with analyzing the supports assessment tool in line with equivalent budgets. Go to the next one. As far as short-term approaches, and this is something that MA21 has been advocating for since 2022-23 without success, is that while we're waiting for years on this SISA assessment and tying it to self-determination, how do we get on with adequate budgets on an annual basis now? And so DDS has indicated now they're prepared to look at short-term approaches. They're reviewing the self-directions, both agency with choice and participant-directed program. They're going to compare that traditional and self-directed budgets, and they're going to do something of a deep dive in terms of looking at how the needs-based allocation is going, the application of the Community Day Assessment Tool, CDAT tool, if appropriate. That was something that MA21 had thought would be a good interim approach 2 or 3 years ago. And then they're going to look at prior increases in individual budgets and again, utilization, what has been the utilization. The commissioner and Jacqueline Grant, the director in charge of special self-direction, indicating that findings are going to be shared March 4th, 2026 at the Self-Determination Advisory Board. So I really encourage people that want to see what kind of short-term approaches DDS might be thinking of in terms of bringing the individual budgets in line with traditional costs and continuing updating that. I encourage you to attend that. Those are public. This is a public body, so there's no participation in the meeting itself allowed, but there is comment period at the end. Okay, next slide. Or I guess maybe that's, oh, so yeah, what can you do about your budget? We would encourage you to make sure you do know what your budget is. You can tell your budget from Agency with Choices and with Acumen. You'll have your budget in the Acumen system, but what you're really supposed to have is an individual budget funding allocation sent to you by the caseworker during the process of your personal planning, and you're supposed to be given your appeal rights. Whether you have that or not, but you can try to make sure you do. You can learn more about the SISA and whether to participate. Go to that Path Forward site, and you can attend the March 4th, 2026 SDAB meeting where the department's going to address shorter term solutions.
And I just want to comment that the SDAB meetings are a virtual meeting, so that is helpful for a lot of folks who are not able to travel. So moving on to independent facilitators. The Real Lives Law calls for independent facilitators the right to select an independent facilitator by participants. Independent facilitators can support persons self-directing with person-centered planning, informed choices about self-direction, and also to stay on top of the short and long-term planning goals. They also are, this role allows for the independent facilitator to help with the transition into self-direction. Again, a link to the Real Lives Law where you can refer to the law regarding independent facilitators. So the current status, DDS regulations established minimum qualifications on October 25, 2024. Again, regulations, the link there, you can read what those minimum qualifications are. The Real Lives Law requires access to a list of independent facilitators. What we learned from the subcommittee, from the SDAB subcommittee, is that DDS requires training for independent facilitators before the list is made available. So the training is not happening right now, and therefore participants do not have access to this resource. So as far as the next steps, DDS just needs to prioritize its obligation under the Real Lives Law, and participants have the opportunity to retain an independent facilitator. We know that, and have access to a public list on the DDS website. We encourage you to attend SDAB subcommittee meetings. The link is provided. I don't have the date of the next meeting, and I'm not sure if you can throw that date out, or Robert. But if you
It's in February. Maybe I'm not sure I can switch gears, but it's on the Self-Determination Advisory Board website. And the one person asked what what SDAP stand for. It stands for the Self-Determination Advisory Board. And one thing I would say is the subcommittee has become very active and they're really, the subcommittee members outside of DDS have been really working hard to get a good job description for the independent facilitator and also to move the process along of the training so that the training can get done so we can have the list of independent facilitators available. So and then from John Williams, the next SDAB meeting is February 11th. And the time of the meetings is 3:30 to 4:30. So the meetings are 3:30 in the afternoon till 4:30 Eastern time. But go to the Self-Determination Advisory Board website on DDS and you'll see both the quarterly meetings of the main group, Self-Determination Advisory Board, and you'll see the subcommittee. You'll also see on that previous meeting records of the Self-Determination Advisory Board. And Jackie, could you, again, she's got February 11th, 3:30 to 4:30. Jackie, were there any chats that I missed because I'm really not able to multitask on chats. So
yeah, I'm trying to stay on top of it, Robert. I was looking up the information as you were talking about it. So I don't think we missed anything else. I've been given links.
Okay. All right.
Thank you. Okay, so at this time, we're going to move over to the presentation that is going to be given by Nora Bent.
Hi, everyone. Hope you're doing well on this very cold Tuesday. Thanks so much for having me today. I'm going to really quickly talk about legislative advocacy and some helpful tools to get engaged in that work. And this extends beyond self-determination issues or opportunities, really is true for any issue you are interested in advocating for, including self-direction. So for those I haven't met yet, my name is Nora Bent. I'm the Director of Government Affairs here at the ARC of Massachusetts. I also serve on SDAB as part of my role. Next slide, please. All right. So I'm going to talk today about some pretty basic advocacy 101 here at the state level in Massachusetts, really focusing on storytelling and relationship building. We could do a full hour-long presentation on advocacy, both at the state and federal level, but I'm going to try to do this pretty quickly and really focus in on the state level today. But when I'm done, I'll put my email in the chat, and I'm happy to connect with anyone offline who wants to talk more or needs any additional support. Next slide. All right. So just to start, we're going to go through the who, what, when, where, why, and how of advocacy. This might be familiar to some folks on the call, and it might be new to some. And even if this is familiar to you, I think it's really helpful to go back to basics and make sure we have all of our I's dotted and T's crossed when it comes to advocacy, particularly around issues that are so important to you and the community at large. So starting with the who represents you in the state house, everyone based on where you live has one state representative and one state senator that are you elect to represent you in the area of the state you live in. And then of course the governor is overseeing the entire state. The map that you see on your screen is a really handy tool on the MAlegislature.gov website, which the link is in this slide, where you can pop in your address and it will tell you who your state rep and who your state senator are and give you their contact information. This slide also has a link to the governor's office contact information, and that's something that your state legislators can also help you be in contact with the governor's office if that's something you're interested in doing. I think it's really important to point out that the staff who work in these offices are really critical here. And I only partly say that as a former staff member in the State House, but staff are really the ones answering the phones, checking their emails, and having conversations with constituents and people in their boss's district. So if you reach out, whether you get the legislator themselves or the staff member, it's really important to use that as an opportunity to share your concerns. Next slide, please. So some key things to know about your legislators before you reach out to them. It can be really helpful to know what types of bills or pieces of legislation they support. Either they're the lead sponsor of it, meaning they file it and really are the ones working on it most closely, or what legislation they have co-sponsored. And when you go to that link that was in the previous slide, you can get a page of their on the website that shows all of their bills, all the committees they serve on, and really all of this information. It can also be really helpful to know what legislative committees they serve on. Every legislator, in addition to filing bills and working with constituents, serves on one or more committees. And the ones that are really relevant to this conversation are the Committee on Ways and Means, which handles essentially all the money. So all the state budgets and any bill that costs money goes through the Ways and Means Committee. And then the Children, Families, and Persons with Disabilities Committee is aptly named, and where many of the bills that we work on as the ARC go through. In addition to that legislative work and committee work, your legislators are also in office to support you as their constituent. If you are ever having a hard time with DDS or Mass Health, or you're having a hard time getting someone to get back in touch with you, you can reach out to your legislator's office and they can be helpful in sort of running your issue or challenge up the chain and helping you get a response. They can also help find the right person for you to contact. So building the relationship with them is not only helpful to advocate for the bills or budget amendments or pieces that you care about, but also if you need support. Next slide, please. So I think we all understand what advocacy is, but I think it can sometimes feel a little bit overwhelming to think about advocacy on a whole. But really all it is about is using your voice and your lived experiences to influence and educate people in positions of elected office. That involves sharing your stories. That's really the most effective way to advocate, and I'll talk a little bit about that more later. But as I said in the previous slide, the piece that's so critical here is building the relationships with your legislators, and that happens over time. Some of you may already know your legislators and have reached out to them, but if you haven't, I would recommend just sending them an email to introduce yourself, share what you're comfortable sharing about yourself or your family, and mention the issues that you care about. This can go a long way to make sure they know who you are, and when you come back to advocate for something or to get some support interacting with the state agency, you already have that relationship somewhat established. Next slide, please. Probably the number one question we get is, how do I do this? Do I have to go to the State House, or can I do this virtually? And really, all of the ways of advocating are important and helpful, and it's about what's most comfortable for you. You can call the office, you can email, you can also connect with our action alert system here at the ARC. This is going to have some really targeted budget and legislative actions that may not be, all of the issues that you care about, but can be a really helpful way to get started. You can also meet with your legislators in the district. So the beauty of this system is that they live in your community. So many legislators will have district office hours or will meet with you at a coffee shop or on Zoom, where you can meet with them and tell them what matters to you, what you care about, and what you want to work on with them. You can also invite them to come to events in the district. If you, work at a day program or your loved one is having some sort of event, invite them there. You can also come join the ARC at the State House. We have 2 events coming up in March and April that are great advocacy opportunities. So encourage you to check those out, and I can put the link in the chat when I'm done talking. Next slide, please. I'll just do a really quick plug for the action alerts, which, as I said, are a really helpful way of getting your foot in the door of advocacy. This is a system that we use sort of like a newsletter. You sign up one time with your email, and then whenever advocacy is needed, we send you an email or a text and essentially give you a pre-populated message that you can plug your own information into, and it sends right to your legislators. These are always customizable, so if you ever want to add something in specifically, you want to tweak it a little bit, you can. but it's a really easy way to get started and takes quite literally 5 minutes to do and really does make an impact to your legislators' offices. This will be particularly important in the next few months as we get into state budget season. So if you haven't already signed up, please do so. Next slide, please. Again, I think we all really understand why advocacy is important, but I think the real sort of meat of this is that it helps your lawmakers prioritize. Your lived experiences are what they want to know and what helps them figure out where to focus their time. Especially right now, there is so much going on at both the state and federal level, keeping advocates and lawmakers quite busy. So you reaching out and saying, I really care about self-direction supports, or I really care about funding for this program, helps your lawmakers understand where they should be spending their time. We often hear that they find it really helpful, especially to sort through these massive, pieces of legislation or budgets to know what their constituents care about. So it can sometimes, I know, feel like you're sort of shouting into a void, but genuinely these emails and calls do get read and they help lawmakers figure out where they're going to focus their time. Next slide, please. So I want to talk a little bit about doing this effectively, and really it boils down to sharing your own story. The legislative process, be it for bills or for the state budget, can take a really long time and honestly can be frustrating at times. So it's really important that you sort of stay persistent and keep on top of it and reach out to us if you need support at any point. Sometimes people feel like they need to be a policy expert to do this outreach or understand all of the intricacies of what they're talking about, but you really don't. Your expertise is in that lived experience and in sharing your story. So if you were to reach out to your lawmakers about something having to do with self-direction, you want to talk to them about what has worked really well. Where have the challenges been? What do you want to see differently? Those are the experiences that they just don't have themselves, right? Maybe they're not living this life. You, just by living your day-to-day or supporting your loved one, can help them understand kind of what's working well and what the challenges are. Often that is what they need to get going, and it helps them prioritize whatever the vehicle is, whether it's a bill or something related to the budget. When you do this, I think it's also really important that you kind of go in with an open mind and try to keep the door open for future conversations. It can be really tempting sometimes, especially when it's taking a long time, to go in with a lot of frustration or feel like you kind of need to demand something. And there's, certainly a time and a place for that, but your lawmakers really are put in office to support you, and 9 times out of 10, they want to do that. So going in with kind of an educational mind, wanting to share with them, thanking them, seeing how you can be of support, and following up with them persistently but politely really can go a long way to make sure this is staying on their radar and they have what they need to support you. Next slide, please. Okay, so that all sounds great, but when you go to pick up the phone or you go to write an email, what am I supposed to say? This can be a really helpful script just to use as a starting point. You want to say you're a constituent, you want to say where you live, you want to, in this case, this example, someone's reaching out alongside the ARC, but you don't have to include that. And you want to, again, say what you care about and say why it matters to you. And then the first thing a legislator is going to think is, what do they want me to do? So you want to be really clear about what your ask is. Either you want them to help you get in touch with someone at DDS. You want them to support this budget amendment that's moving through the legislature. You want them to sign on to a bill, or you want to meet with them. All of those are really great asks, and it depends on the situation you're writing about. And you want to offer to help, right? Lawmakers have a lot on their plate. Their staff are really busy. And if there's something that they can give you to do to be of support, that's really important. Most of the time, that's just sharing your story and talking with them. But they might want to get more information or sort of have a deeper conversation with you to find something out or think about where else in the state advocacy might be needed. And again, we are always happy to help. If you are having a hard time with that initial outreach, just reach out and we're happy to support you. Next slide, please. As I've said, the sort of ultimate way of doing this is really that storytelling. And I think there's a slide later on that includes some information on a webinar that the ARC is doing in a few weeks that will be a two-parter. Part one is later this month, really on storytelling for advocacy. So if this is something you want to sort of hone your skills on, I would encourage you to attend that. We also have a advocacy resource center on our website that it contains a quick guide to storytelling for advocacy. So lots of resources and supports out there to help you figure out how to tell your story. But essentially, you want to remember that you're the expert in this, whether it's your own lived experience, your experience caring for a family member, or some sort of professional expertise. Just by living the life you do, you are the expert here. You want to be really clear and concise and connected to an issue. So if you're writing about an issue with self-direction, you want to provide the details that are necessary, but you don't want it to be, too long or contain every piece of information that the person could ever want. And you want to really connect it to the ask and what you want them to do. Explaining that impact of this happened or this, type of system wasn't in place or my budget wasn't increased and here was the impact. That impact is really what moves people to act. So it's really important you include that. We talked about including a clear ask and a reminder that it's okay to follow up. Sometimes things get lost. Sometimes legislators need a nudge. And again, you can do that really politely. I think all of this policy work can feel sort of complicated and confusing, but I just want to really remind people that the stories are what make people move to action here. We hear from legislators all the time who say, I get that issue, but I want to hear from someone in my district who's experiencing it. Or I kind of get it on a policy level, but I want to hear that experience of an individual. So it's really important we're sort of funneling those stories directly to them. Next slide, please. Really quickly, I'll just talk about relationship building. Again, you want to kind of have continuous conversations with your legislators as best you can. But I also encourage you to build a relationship with us here at the ARC, with groups like MA21 and others who are doing this work every day. Myself and my team are in the State House constantly having conversations with legislators. So that trust really builds over time, and we can be helpful in bringing up these challenges, particularly when there is a bill or something moving related to the budget. It's also, for another conversation, important to understand some of the internal State House relationships and how those factor in. We probably don't have a lot of time for that today. Just really try to focus on your own relationship with your own elected official and connect with us to support you in all the other ways. Next slide, please. Okay, I know I'm talking really fast. There's a lot of information here, and I want to leave lots of time for questions and other parts of the conversation. So just some really key takeaways here. Advocacy makes a difference. You really need to just focus on your own story and your own experiences, and organizations like the ARC or MA21 can really help you and provide you with those tools to make it an easier lift on your part. If there are issues you are interested in where you need support or you want to connect with us, please do let us know. Again, I'll put my email in the chat, and I'm happy to talk with anyone at any point about any type of advocacy. Next slide, please. Okay, this is just a really helpful checklist just to get started. Obviously, you want to make sure you're registered to vote. You want to find out who your legislators are and sign up for their newsletters, social media, reach out to introduce yourself, and then some links to our newsletter, our action alert system, and our resource center, which again has lots of really helpful resources. Next slide, please. And then I mentioned earlier, we have an upcoming webinar on storytelling for advocacy, which the link for registering for the January 26th, part 1, and then a to be announced part 2 is there. We also are entering budget season, and the governor's budget proposal will be out in 8 days. So if you are interested in reviewing that with us and thinking about what advocacy is needed, please register for that webinar. And then I mentioned earlier, we have 2 events at the State House later this spring, legislative reception on March 10th and Autism Advocacy Day on April 8th. Those can be great excuses to come to the State House with other advocates, schedule a meeting with your legislators, and talk about the issues that matter to you, including self-direction and other issues you want to talk about. Next slide, please. That's my email. I will put it in the chat. Thanks for bearing with my caffeinated ramblings here. Truly happy to chat offline if folks have questions, and appreciate all the work that you all are doing.
Nora, thank you so much. That was very helpful. And if anyone does have questions right now for Nora, we can address those questions now. Or like she said, you can reach out to her directly. Okay. Okay, so earlier I had mentioned that,
Diane,
oh,
sorry. Before we move into the future webinar topics, we did get a question earlier about access to an independent facilitator. I don't know if anyone feels comfortable to kind of address that topic, but John had a question. Can you get access to an independent facilitator if you haven't signed up for self-direction? And is there a cost to the DDS client? Now, I know that issue of the independent facilitator is still up in the air, but I didn't know. I don't have an answer for John. I didn't know if anyone else on the team did. But I wanted to, before we go into the next topic, address that issue about independent facilitators.
the first thought that came to my mind was what's called a personal agent. I believe I have that title correct. So, and Robert could chime in if he wants, but John may want to speak to the service coordinator and inquire about a personal agent.
So DDS has indicated that in the absence of being able to have an independent facilitator, because no one right now can have an independent facilitator because there are no independent facilitators until this training is completed, until there's a list. And so we're 11 years into the law and there are no independent facilitators. But DDS has indicated that for the participant-directed program and not for the agency of choice, but for the participant-directed program, personal agents, which is a service that is offered, just like in-home services or day programs or whatever. It's a service offered by DDS that is paid for by DDS. That is available to people. So I would say that John, yes, go to your coordinate your caseworker and determine or not whether you can get a personal agent. And if you have difficulty with that, you're welcome to contact the MA21 website, and we try to help.
Okay. So future webinar topic ideas. This is a list that the action group came up with. And by the way, I'm going to take advantage of this time right now. I just said action group. So MA21 action group. The work that's done behind MA21, we mentioned earlier, the list of the partnering organizations, they contribute to the work of MA21, but we're volunteers. Many of us are volunteers, and we would love for the action group to grow. So if you have an interest and you want to learn more about what does that mean, action group, it's all about planning, putting these presentations together, research, you know, exactly what the name says, take action. But if you are interested, please send us an email and we can go ahead and set up a time to discuss again what that role could look like for you. So we meet, the action group meets usually on the third Thursday of the month for about an hour. The work is done in between meetings. So if you have, our plates are full, but if you have 1 to 4 hours a month that you can contribute to the work of MA21, it would be so awesome to have you on board. Okay, so at this point, I'm not gonna, so we're not gonna stop the recording, but I'm going to escape from the PowerPoint presentation. As I said earlier, the last page of the slide deck has the links that could be extremely helpful to you. But I want to go ahead and stop sharing my screen so that we can get some feedback on webinar topics. And then from there, we will stop the recording and have an opportunity just for casual discussion. So let me just. So before we talk about the topics, I think that we do need to look at the chat. Are there any other questions, Jackie?
I think we're on top of the ones that came in previously, but Cheryl just wrote she's interested in learning more about the action committee. So I think it's worth talking about that group because it is very much driven by your interests. If you have a compelling question that you'd like to learn more about and you want to get involved in doing some research, I mean, that's something the action committee would welcome as we're looking at ideas for topics and information to share with the MA21 group because we do learn from each other so much. And that's really our focus, is to provide information so that you can do a better job of managing your self-direction program. But I don't know, Diane, if you had other thoughts about the action group.
Well, again, the action group comes together. We talk about, we talk about the current status of the law, of the self-direction service model. It's, if you look at, if you jump on the MA21 document library, that was put together because of, volunteers in the group. The latest fact sheet that was also developed based, with the help of the action group. We had one person, come up with a draft, and then we come together and we make sure that the information is accurate. So, the action group is exactly what what it says, action. We have to take, like, what can we do that's going to help with the advocacy around the implementation of the Real Lives Law. The work, this presentation today was put together, with the help from the action group. Robert, is there anything you want to share?
No, I think that I'd like to move on to the extent we can. The webinar topic ideas, and I don't know if we don't have it on the screen now. We might want to put it back on for just a minute. But one of the things that the action group has done is that in putting together the MA21 large group webinars for the last since November of 2024, that's been a main purpose has to provide problem-solving webinars. So again, we had the individual budget equivalent cost in November of 2024, and then in 2025 we had the needs assessment, we had acumen, we had appeals, and we had the MDEC survey, which came out of one of the members of the group, and we've looked at the MDEC survey. So now we're really looking for input. This is an action group decision. We're looking for input from this broader, larger group as we move on in 2026 to accelerate our knowledge of self-determination and also our advocacy, individual or system-wide. So I would really welcome people saying what they feel about these topics, if they're priorities for them, or what other priorities they might have.
Don't be shy. Okay, Hope.
Yeah, I think based on my experience in self-direction and a lot of people that I know, I think more energy and time could be spent on the budget, understanding the budget, understanding how it really relates to traditional services, trying to get a number for what traditional services actually are, and what costing. For our loved ones because I do the hybrid. I do 3 traditional and I do 2 self-direction days right now. And it's, I have to fight. I've been able to get the money that I need to do self-direction for my daughter, but I've had to fight for it. And I sometimes, multiple times during the year, I have to fight because something changes. I need more time with the more expensive person, then I can't find the cheaper person that they want me to find. So I just think that there needs to be um, a deeper dive into helping people to understand what to ask their DDS representative for, even coming up with a budget and how to present it. I think that those things could be really helpful.
Thank you.
Welcome.
Anyone else?
I think the understanding the rates and the rate ranges is also important because it is an overwhelming process. So I think any way we can break down or give people templates or some kind of guides to use is helpful. I still, as a group, would like to advocate for a DDS to negotiate statewide contracts on things like the YMCA or other programs that could be used by everyone to give people a menu, just even as a starting point, whether you use those things or not, but it would make the overall budget go further and would at least give people kind of an idea of how to build a budget.
Great
So
suggestion.
it's interesting because the department has matrices that a couple of them that relate to self-determination, and they're very, the rates are there, and then there's even a 257 rate. So this gets into a very technical area. But it's, for instance, in my own situation with our son, I use those matrices because they tell me what my rate ranges are for the particular service I'm interested in. And I have to, when that rate range, for instance, was adjusted because of Chapter 257, it was adjusted upward, and then it allowed me to, increase the compensation to an in-home support provider. So the only thing I'm concerned about on rates, and this gets into, there are published rates, but they're matrix and they're very complicated in my mind. So, do you think that the deep dive into rates and rate ranges is, my question is whether it's going to be helpful or not, because it is complicated, but for me, they're very important. I look at them. But I have to decide which ones are important to me because 99% of them are not important to me. But hey, I want to know what the one or two that are, because it establishes my budget and it tells me where I need to have an increase in the budget because traditional costs have increased. So,
Karen?
Paula, having said that, do you still do you think that's worthwhile?
Well, I just put it in a comment. I think for me, a deep dive might overwhelm people even more, but I think a basic, like breaking stuff into layman's terms. So like, I didn't even know that existed. And I can tell you, like when they pushed me I'm just, so I'm both a provider for employment services and we have a CBDS program here and but I'm also a parent. And when they asked me to do my son as self-direction, I was like, no way. because just looking at it made me want to throw up. I took agency with choice to take some of the pressure off, because I was just like, it's just too much. I can't manage all of that. It's a full-time job. So I think anything we can do to simplify the process and bring it down to like layman terms and tasks that people can get their arms around, that's the kind of trainings and information I want to see.
Okay, and let me just say one thing on that. You know, if you get to numbers, we've got 2,600, 2,700 in self-determination right now, self-direction. About 1,100 of those are in agency with choice, so roughly 40% of 2,600, and the others are in participant directed. And the very reason that Paula talked about agency with choice, that's an advantage of it for some people. You know, it's an advantage. It's not as, but there's advantages of participant directed too. That's why there's, 1,500 in participant directed on the whole. But, if someone like you, Paula, if I could get you those matrix and we could just at least discuss how we make it worthwhile to people, that's the dilemma I have. Because there's just, there's nobody inside DDS that's really probably going to help on it. It's probably going to have to be done by, volunteers. So I would like to get into that area, but I don't want it to be so technical, and I have a technical background, so I tend to make everything overcomplicated. Okay, so, and thank goodness you have PowerPoints and Diane Huggan that can reduce my detail into bullet points. But anyway, if you had the time, I'd like to share the matrix with you so you could see where I'm coming from on it, and maybe you could give some help on it.
So we're gonna, Karen Venti, you had your hand up.
Yes, hi, thank you. I just wanted to mention, I don't know how many people here have kiddos that they're looking into self-direction for because they have medical issues along with whatever. I'll currently have some part-time programming in a CBD or community-based programming. And we send her nurse along with her. And I read of some programs that allow that, some programs don't allow that. We haven't found easy programming. We don't want to bring just people into our home. We want her to go into the community. And there are these little hurdles, one after one, that we come into even when we send our nurse to the program. Like, for instance, we're still trying to iron this out, but it sounds like possibly they can't transport her because the nurse is not an employee, so therefore might not be covered by their liability insurance, which, while that makes sense, it seems like it should be something that could be manageable, because then she just, continues to stay more isolated. And I'm just wondering if people have had any luck with doing creative programming for their kiddos that also have a medical component.
So you're, because your connection is choppy.
Oh,
Okay,
I'm sorry, that's too bad.
all right. I
Did you
believe it's
hear,
on.
did you hear any of it?
Yes, we did. So I just want to
Okay.
clarify, is your question, is anyone self-directing, someone with medical challenges using the self-direction service model? Is
Yeah,
that
I'm
your
wondering if that's a better
question?
model. Because like everybody has said, it takes a lot of time and effort to put together. There isn't just a list of places to go to call and find out if there's openings or what they offer. Like, it's kind of like starting from scratch. And I don't have a lot of time that I'm not where I'm not caregiving, or that people are in my home. So it's hard to do the balancing. I'm sure that's everybody's issue.
Okay, so I think
I thought you were asking about possible topics for later. So my suggestion was one that kind of invited people with this medical component where they're kids are able to do some community access, but they need additional support. Is anything existing? Anybody have any good ideas? That kind of thing.
Okay, thank you so much for clarifying. And again, some of your
Okay, thank you.
earlier your connection was choppy, so I personally was not grabbing everything. So that is now very clear to me.
Okay. Okay, thank you all. Bye, Jackie.
Okay, Hope. Oh, you're on mute, Hope.
Sorry. So I just wanted to comment back about the matrix that Robert was talking about, to help out with what Paula was expressing. And that is really helpful to have that matrix. Is that available on the website? I didn't get it from the website. I got it from, because Robert helped me and Ed helped me when I was having issues fighting for more money for my daughter's budget. So that's where I got it. But I'm just wondering if that is available on the MA21 website.
It's on the MA21 library.
Okay, it is. Okay. And the
And
other
if
thing,
anybody would need to, the library is fairly complicated, and it's one of those documents that's a very technical documents. There's two of them.
yeah,
So if anybody has any trouble finding it, I'd be glad to send it to them if you just, get a message through MA21. But they are on the two of them are on the website, the library.
and it does, the matrix does give ranges, which for positions and based on the qualifications of the person that you're employing. I have found that when I share the range with my DDS person, it's always like, yeah, but we usually like to pay, where most people are paying on this end of it. And when you express the qualifications and why you need more money, I've experienced pushback every time. I've been able to overcome it, and I've been able to get close to what I want. But there is a lot of pushback, and there is a lot of most people are getting paid, and they always go to the lower end of the range of the matrix, has been my experience.
Yeah, well, again, this gets into a seminar, but you can't, the issue of going to the higher range, it needs to be tied to the traditional cost of services, because you
Right,
can't just say I want more money because I want to pay more. It's just,
right,
and you have to be you have to be looking at the assessed needs and what the traditional costs would be. But that's very difficult because the department has not determined any methodology for that. So what you're talking about is what will happen. And even if you don't necessarily use the right argument, the rate ranges are very good because they tell you what you're, at least in some extent, what the range is, and then you look at your qualifications of what you need, and at least you find out, this is the type of compensation I need to pay to attract that talent. That's the issue. But anyway, I agree with you, Hope, and I think that getting down to the individual annual budget, that's transparency and appeals. That's another way of approaching it. Okay, so that you don't just have the pushback that, well, your individual budget won't provide you very many hours if you pay that compensation.
right. And they make you well aware of that.
Yeah.
There's going to be a trade-off. And it is hard to get them to tell you what they're paying for traditional services. That is a challenge.
But yeah.
Donna Cushy.
Hi, I just wanted to say that, I've been doing self-direction way before self-direction was an actual service for quite a while. And back in the beginning, when they were first putting this out, all of this information was public information. The rates and the service definitions, it was all out there. And it was easily accessible, and it made it easier to kind of connect the dots on how to build that, what your family member needed. And I'm sad that that's gone away, but I'm glad that MA21 still puts that information on your website, because that is needed information. Even if it is confusing, the matrix and the service definitions are critical to understanding what it is you're trying to build with that budget. That's just my comment.
Thank you. If we,
Cheryl had a suggestion, Diane. Did you see that in the chat?
no, because I'm still sharing my screen, so it's
Oh,
difficult
I
for me
texted it
jump
to you
around.
too. Okay, so Cheryl had a suggestion for future topics related to assistive technology in self-direction program and how that would tie into the budget, being able to really take advantage of assistive technology and how to tie that into the program and the budget, which I thought was a good